Have you ever wondered what it means when someone says they have bronchitis or COPD? Well, let's dive a little deeper into the world of respiratory health to understand these often misunderstood conditions. Bronchitis and chronic obstructive pulmonary disease, commonly known as COPD, are two prevalent conditions that affect our respiratory system. Bronchitis is an inflammation that targets the bronchi, the main passageways that carry air to our lungs. On the other hand, COPD is a term used to describe a group of lung diseases, which includes chronic bronchitis and emphysema. These conditions can cause a range of symptoms, from persistent coughs to breathlessness, and significantly impact one's quality of life. Despite their prevalence, there's a lot of confusion about what these conditions really are and how they differ. Now you might wonder what exactly happens in our bodies when these conditions strike. Picture this: your bronchial tubes, which carry air to your lungs, get inflamed or swollen. This isn't a pleasant scenario, is it? But that's essentially what bronchitis is all about. Bronchitis happens when the bronchial tubes, those crucial airways that carry oxygen-rich air to your lungs and carbon dioxide away from them, become inflamed or swollen. This swelling narrows the airways, making it harder for air to move freely. It's like trying to breathe through a straw. When the bronchial tubes are inflamed, they produce excess mucus. This mucus can further clog the narrowed airways, triggering a persistent cough as your body tries to clear the blockage. Other symptoms can include shortness of breath, wheezing, and fatigue. Now, bronchitis isn't just one size fits all. It comes in two types: acute and chronic. Acute bronchitis is usually the result of a viral infection and tends to resolve itself within a few weeks. It's like a bad cold that just won't quit. Chronic bronchitis, on the other hand, is far more serious. It's a long-term condition, often caused by prolonged exposure to irritants like cigarette smoke or air pollution. With chronic bronchitis, your bronchial tubes are perpetually inflamed, leading to a constant cough and difficulty breathing. So, that's bronchitis for you. But how does it differ from COPD? Let's delve deeper. Now imagine, not just your bronchial tubes, but your entire lungs are under attack. This is the reality for those living with chronic obstructive pulmonary disease, or COPD for short. COPD is not a single condition, but rather a group of diseases that obstruct the airflow from the lungs. This obstruction leads to breathing difficulties that can range from mild to severe. But what exactly are these diseases? Well, the two main culprits are chronic bronchitis and emphysema. Chronic bronchitis is an inflammation of the lining of the bronchial tubes, which carry air to and from the air sacs or alveoli of the lungs. This inflammation causes the lining to thicken and produce excess mucus, leading to coughing and shortness of breath. On the other hand, emphysema damages the walls between the alveoli, causing them to lose their shape and elasticity. This leads to less oxygen reaching the bloodstream, and the sufferer often feeling like they're gasping for breath. You might be wondering what causes these conditions. While there are several factors, smoking is a common cause of COPD. The smoke irritates the lungs, leading to inflammation and damage over time. It's important to note that while bronchitis can be acute or chronic, COPD is always chronic and progressive. This means the disease worsens over time and the symptoms become more severe. So, COPD is a more severe progressive disease that can greatly impact a person's quality of life. So we've taken a journey through our respiratory system, haven't we? We've explored the intricate world of bronchitis and COPD, two conditions that affect millions globally. In our exploration, we've understood that bronchitis is an inflammation of the bronchial tubes, often due to infection or exposure to irritants. On the other hand, COPD, or chronic obstructive pulmonary disease, is a group of progressive lung diseases, including emphysema and chronic bronchitis, which obstruct airflow and make it increasingly difficult to breathe. Although both conditions involve the respiratory system, they differ in their causes, symptoms, and treatments. But they share a common thread: the immense importance of early detection and effective treatment. Understanding these conditions is crucial not only for us as future medical practitioners, but for everyone. After all, prevention is better than cure, and knowledge is the best prevention. Remember, knowledge is the first step towards better health. So keep learning, keep asking questions, and stay healthy.